Hello, everyone. Happy Monday. This is Rob Van Bergen from Pain Free for Life. Hope everyone's doing well. I'm going to be talking today about inflammatory pain versus degenerative pain. And the reason for this is that this is something that I come across quite often. I'm constantly meeting new patients, new clients, and it's always trying to determine kind of what's going to work for them. So there is a difference between inflammatory pain and degenerative pain. So here's the way I like to think of it. If you're considering pain that won't go away, right? So you're experiencing pain that's just persistent, won't go anywhere. It's not going to relent. The question that you have to ask is what kind of pain it is. We often jump right to inflammation as the source of pain. And as pain and inflammation are intrinsically linked. So after the four symptoms are considered, right, of inflammation, you've got swelling, pain, redness, and heat. Now notice pain is prominent in there. Now eventually there's a fifth symptom, which is loss of function, and that's if inflammation is left unchecked to be able to just keep burning and burning and burning. So it stands to reason that inflammation is at fault for your pain, because pain is part of that definition. So we consider the cycle of inflammation. Inflammation is meant to come on and then go away. It's an important part of the healing process. With chronic pain, most of the time, inflammation is sticking around. It's not going anywhere. And it may linger for a while, and it's going to do damage as it does, right? And then it will shut off. Now, this could be over the course of weeks, months, or even years of just persistent pain before that inflammation goes away. So I've used this analogy before. You guys are probably sick of it by now. But just like a fire burning in a room, right? That's what inflammation is. If the room is part of your body, the fire is burning in a room. When it's extinguished, the inflammation, the fire, has left behind a huge mess to clean up with lots of damage. You don't have a fire in your bathroom and then have everything in your bathroom be fine. Things need to be replaced, repaired, right? There's damage that is done. So this is when I like to try and determine whether the pain is inflammatory or degenerative. Okay, so we have to look at where it is. So while inflammatory pain is the result of the inflammation present in the area of your body, like your wrist, for example, then degenerative pain is the aftermath. It's like the scorched earth effect of our body. Like, what has the inflammation done? And we have to fix that. So consider this then. If you have pain and you find that working on anti-inflammatory programs is not working at all, you could very well be dealing with degenerative pain. So while treating inflammatory pain with, say, 350 hertz in your evolution here is going to be good for dealing with inflammation present in the area and resolve the root of the issue if it's inflammatory based, it's going to do little to resolve the issue if it's degenerative. So degenerative pain is the result of the damaged tissue causing like a minor inflammatory response. It's like a flare-up, and that triggers the pain response. So in this case, the root of the problem is not inflammation, but it's degeneration. It's the tissue being damaged that's causing the pain. So treating anti-inflammatory on that is not going to really do it. So it's just working on a symptom that's flaring up of the root cause rather than the root cause being inflammation. So instead, if you suspect that the pain is degenerative, you want to work on a lower frequency program. And the best for this is by far RSI or fMRSI. You'll often hear people say that fMRSI and RSI are great for chronic pain. And this is why. Low reparative frequencies delivered quickly to the area through all of the pulses added into the device works to repair the damaged tissue and resolve the root of the chronic pain, because that chronic pain has created degeneration and is no longer the result of chronic inflammation. So here's my strongest recommendation, guys, is to make sure that you always treat pain briefly for inflammation and then move to regenerative frequencies to counter any degeneration. It doesn't matter if that reparative frequency might be 77 hertz. Treat anti-inflammatory and then go on and do some regenerative, okay? Repair cannot happen in the presence of inflammation. The inflammation does not, it kind of blocks the repair. So make sure to take out any inflammation before you start to repair. So even if you suspect this is chronic degenerative pain, Rob, I know what I need to do now. I need to go with RSI. Do a couple of minutes of anti-inflammatory first to bring the inflammation in the area down enough that you can get in and repair it. Okay. Okay. So thank you so much for joining me, everyone. I just wanted to announce here as well that we have a crash course on arthritis and gout at 4 p.m. Pacific Standard Time, which is 7 p.m. Eastern Standard Time. This is for people who are monthly and lifetime members of the Hache Protocol private membership. So if you are a member and you want to attend, make sure to be in the private membership Facebook page at the time the event starts. The link is in the description below. Otherwise, or above. It might be the description is above. It is. Otherwise, I will see you next week for another Monday training. If you have any ideas for what you'd like me to talk about in one of these training sessions, feel free to drop them below. I'd love to hear what your suggestions would be, and it might just make it into one of the upcoming weeks. Otherwise, thank you guys. Have a great week. As usual, we're here for you. If you need anything at all, just post on the page. We'll be happy to help. Take care. Have a great day.